Hello, and welcome to the African American Men of Westchester Health and Education session on mental health. I am Edwin Bowman, co-chair of AAMW's Health and Education Committee. This month, the month of May, is designated as Mental Health Month, and I welcome you to this session that focuses on mental health and wellness and their implications for African Americans. I am pleased to introduce our presenter, Mr. Terrence Nichols, licensed mental health counselor in New Jersey, and who functions as a psychological rehabilitation therapist on an inpatient unit at New York Presbyterian Hospital in White Plains.
1 out of 5 adults in the United States experiences a mental illness every year. That equates to 52.9 million people every year experience a mental illness. 1 out of 20 experience a serious mental illness every year. We find that 50% of all people who have a mental illness, they find signs of it at age 14. 75% of those who experience or have a mental illness, they find evidence of it by age 24. The second leading cause of death in the United States for people between the ages of 10 and 34 is suicide. And later on, I'll talk a little bit more about other, when we look at all the ages, we find that it's about the 10th leading cause of death. We find in the APA, the American Psychological Association, what they did is they put out a lot of information, also stats, and I just want to share some of them with you. One is that the rates of mental illness among African Americans is similar to that of the general population. However, there are some disparities that exist. Mental health services for African Americans tend to be poor quality of care, and they lack the access to culturally competent care. We find that also compared to non-Hispanic whites, African Americans with mental illness tend to have lower rates of use of mental health services outpatient, such as prescription medication and using outpatient resources like therapists, but higher use of inpatient services. And that suggests that folks are just holding on as long as they can until things escalate to the point that they actually have to be committed to an inpatient hospital. Compared to whites, African Americans are less likely to receive guideline consistent care. They are less frequently included in research, which is really important because research guides treatment. So if they're not using us enough in sample sizes, then we're not sure that we're necessarily getting the best treatment. And they're more than likely to use emergency rooms, African Americans, than to go to outpatient providers. Lastly, in this stat, it was really staggering. We find that 1 out of 3 African Americans who need, not want, who need mental health services are getting them. That leaves 66% of the African American population who need mental health services without support, and it leaves them suffering. And that's why we're having this talk today. I really want to help build awareness in the African American community. One thing that I tend to find is that across all the diagnoses of people that I've treated, there tends to be one common denominator, and that is stress. So I want to talk a little bit about stress now. The first thing I'd like to say about stress was, let me first define it. It's a physical or mental emotional factor that causes bodily or mental tension. The thing about stress is no one is exempt from having stress. Stressors can be internal stressors where things happen to us biologically, changes in our body chemistry can lead to stress, or they can be external factors such as something happening at work, in your environment, in your household. I want us to look at all the symptoms of stress, but I'm going to break them down into 3 different categories. The 3 categories are physical, emotional, and behavioral symptoms. So an example of a physical symptom that someone may experience when they're stressed is they might feel their body get very warm. Something they might experience when their emotional symptom they might experience if they're stressed is that they might worry excessively. And lastly, something they might do behaviorally if they're stressed is they might find themselves pacing back and forth. But now I want to really just go through all of those symptoms, because you might say, if I asked you, if you were with me, what symptoms do you experience when you're stressed? You might be able to name 2 or 3, but when I go through this list, you may be able to identify with more. Okay, so the first one is headaches. Some people find that when they're holding on to stressors, they tend to experience migraine headaches. And that can be debilitating. Some people experience changes in sleep. You can have either insomnia, which is lack of sleep, or you might experience hypersomnia, where the person sleeps excessively. Well, why would someone do that if they're stressed? Well, when someone's stressed, they might experience insomnia because, you know what, they can't turn their thoughts off. Whatever that thing is that's stressing them out, it just kind of keeps looping in their mind, and they find it difficult to go to sleep, or they have interrupted sleep. For those people who experience hypersomnia, their thought is, you know what, if I can just go to sleep, I can avoid thinking about whatever that's bothering me, and I will get at least some immediate relief. The challenge with that strategy, of course, is that they don't address the main cause of the stress. And if the thing that they're trying to avoid is something that's time sensitive, they just made matters worse, because when they wake up, they have less time to accomplish what they need to accomplish. Some other things that happen: trembling limbs, right? If you start to get nervous, you might notice your hands start to tremble. Neck pain and back pain, it's a big one. I know I get the neck pain if I'm up late working on something because I procrastinated and waited too late and it's due the next day. Some people experience dizziness or sweating. I interviewed people at the hospital pre-pandemic, and I would always brace myself before I shook their hand because they were often sweating. And the reason why is because they were stressed, right? Some people experience frequent colds, and this is a big one. It's important to know that if you hold on to stressors, a lot of little stressors or some big stressors, it can compromise your immune system, make you more susceptible to getting ill, right? If you find yourself having frequent coughs and colds, and as soon as it clears up, you have another one, chances are you're holding on to a lot of stressors. Some people experience stomach pains, right? You may go to your doctor, get a colonoscopy, endoscopy, all the oscopies, and they may all come back inconclusive. Oftentimes, when the stressor is gone, let's say someone is in graduate school, and in that last semester, they have these symptoms. When they graduate, guess what happens? The symptoms tend to subside. Some people experience constipation, hyperventilation, and if I was getting ready to step on stage to give a presentation and my stress level was really high, I might feel dizzy, nauseous, lightheaded, and we call that a panic attack. And panic attacks can be debilitating. When you're experiencing one, the book that we use to diagnose people, the DSM-5, says the person might feel like they're having a heart attack or dying. It could be that intense, and it comes on suddenly, all caused by stress. Sometimes people experience decreased libido. Some people experience restlessness. They just can't sit still. Chest pains, again, you might feel like you're having a heart attack. Some people engage, believe it or not, in self-injurious behaviors where they end up cutting themselves, burning themselves, or banging their head as ways to release stress. And in talking with some of these folks, they say, Terrence, it was just a way for me to release. Excessive worry, I kind of touched on it a little bit earlier, but the one thing that we find with worrying is we could probably all attest to the fact that sometimes we worry about things, and then we later realize we worried for no reason. And the reason for that is that worrying is a mental exercise we put ourselves through, right? It is us anticipating that something will or will not happen in the future that may not be based on any factual information at all. The good thing about knowing that we're the source of our worry is that then we know that we can control it, right? If it was some external entity that was causing our worrying, then we would feel like we were helpless and we couldn't manage it. But because we're the sources, we can actually control our worry. Anger is often the byproduct of stress. If I go to my favorite deli to get my breakfast sandwich and they burn it, and then I am traveling to work, and usually takes me 45 minutes to get to work, but today it took me 2.5 hours to get to work, and usually I have to read 20 emails, but today I have to read 75 emails, and on the way home, I get a flat tire. Chances are I'm not going to be in the best mood when I walk through the door, right? All of those stressors, particularly if I don't address them as the day goes on, build up, and then we end up taking that stress out on innocent bystanders, right? Something very slight, somebody might say something that would normally not bother us, but then it kind of is like the straw that broke the camel's back. So we don't want to do that. When we hold on to stress and we lash out at others, we often say or do things we later regret. Then we have appetite, kind of like sleep, it can go up or down. Some people, when they're stressed out, they find it very difficult to eat anything at all, because when they eat something, even something small, what tends to happen is their stomach gets upset. The opposite is also possible. Some people, when they're stressed out, they take that trip from their bed or their sofa to the refrigerator, and they know there's nothing in there that they really want, but they take that trip anyway. They open that refrigerator door, grab something out, go back to the bed or to the sofa, and guess what they're doing a few minutes later? They're taking that trip again. Why? It's an effort to comfort themselves. People often eat to comfort themselves when they're stressed, but it causes another problem. It can cause obesity and other issues. Some people experience depression, right? If I hear rumors of layoffs at my job, right? And then I start to think to myself, my goodness, I'm going to lose my job. I'm going to lose income. I'm not going to be able to provide for my family. We're going to be homeless. You can see how that could catapult you into depression. So oftentimes we'll see stress interlocked with depression and with anxiety. Difficulty concentrating. Maybe I go to work and usually, again, I pump out 50 emails and effortlessly. But when I'm under a lot of stress, you know what, it may be difficult to compose a single email because I just can't concentrate. Some people feel overwhelmed or burn themselves out. You know, when we take on a lot of responsibilities more than we should, it leads to us feeling overwhelmed and burnt out, which is stressful. We find that people experience feelings of worthlessness when they're stressed. It may escalate to people having suicidal thoughts. Talk about that a little bit later, but some people, they get so stressed out, they think to themselves, there's no other option but to do some harm to myself. Some people have excessive defensiveness. Every little thing sets them off when they're stressed. Some people have reduced work efficiency, again, because of the lack of ability to concentrate when they're stressed. Some people bite their nails when they're stressed. Drugs and alcohol. This is often a go-to. Again, it's not a constructive go-to, but people often will try to manage their stress levels using drugs or alcohol, particularly alcohol. Alcohol is depressant. And one thing I always share with people is that, yes, if you're stressed and you drink alcohol, it will calm you down. But with every drug or alcohol, there's a rebound effect. So with alcohol in particular, the rebound might make you irritable. It might impact your sleep, so you're not able to sleep. And because of that, you know what people do? They drink again, right? Because they don't like those symptoms. And then it starts this cycle of drinking over and over. Your body builds up tolerance. And before you know it, you might get to the point where your body rejects if you try to withdraw from, or you might withdraw if you try to stop drinking. And last thing I want to highlight is isolation. When people are stressed out, oftentimes they feel like the last thing I want to do is be around other people, when that may be the very thing that can be helpful for you. Alfred Adler is one psychologist that I'm partial to a lot of his work. He has this thing called the theory of social interest. And he said that whether you're an extrovert or an introvert, we have this need to feel connected. When we isolate ourselves, we deprive ourselves of that connection that is vital for our mental health. And if you think about it, when people are incarcerated and they want to punish them, what do? They put them in isolation. Sometimes we put ourselves in isolation and it has negative effects on our mental health. So we'll never get to the place where we say, you know what, I'm never going to experience a stressor again or be stressed again in my life. So the best thing we can do is learn how to manage it. I just went through and took that time to go through all these symptoms for a really important reason. And I like to use the analogy of a snowball. Well, two things happen to a snowball as it's rolling downhill. The first thing is it picks up speed or momentum. And the second thing is it gets bigger. All right. The same thing happens with your symptoms when you're stressed, right? You start off, there's a stressor, you don't address it, you're sleeping or napping 1 hour in the afternoon. Over time, it develops into 5-hour naps in the afternoon. Before you know it, you're sleeping 20 hours a day. And now it's picked up momentum and then it becomes more resistant to interventions. So when you start feeling any of these symptoms coming on, you want to address them while they're a little snowball before they pick up that momentum. There's some constructive ways I want to talk about and how you can reduce stress. The first thing is identifying the trigger. I often meet people, they tell me how stressed they are, they express the intensity of their stress, and then I say, well, what's the cause of their stress? And they say, I don't know. Well, you have to identify it, right? Because we can try to mask the symptoms, but we want to attack it at the source. So the way that I often help people define what the trigger is, I say, well, when did you start experiencing the stress? And they usually can identify a point in time. And then I say, well, what was happening at that time? And once they look at it from that perspective, they can see or identify something that happened, and then they can start addressing that. to help alleviate stress. Another big one is people are reluctant oftentimes to say no or set boundaries with other people. And it is really important, because if we don't do that, we overextend ourselves. You know, if you're walking down the street and you pass by a property and on it, there's a sign on the property that says, "Do not trespass," you know, just by reading that sign, that there are going to be consequences if you pass the border. Well, the boundaries that we have are invisible, which so no one can see them. They tend to change over time, and they're unique to every individual. So the only way people are going to know if they're encroaching on our boundaries is if we express our boundaries to other people. So we need to be okay with saying no when something is not going to be good for us. Oftentimes people want to be people pleasers because it feels good to make other people happy, but it's at our expense. The other thing that tends to happen with people pleasers is when you keep agreeing to do things, even though you don't want to do them, what happens is over time, you attach your self-worth to your ability to meet other people's needs. And the moment you let them down, your self-esteem plummets. So we don't want to do that. Taking a break from your stressors is really important too. Sometimes there are stressful things that happen at certain periods during the course of the day. Do something to relax before and or after that. We find that, you know, you can also, some people, if you're going, let's say I'm going to a doctor's office and I have blood work done and it's Monday and my doctor says, "Terrence, we'll have the results for you on Friday." And I think to myself, you know, maybe you go online, you do some searches, you say, "I did have a little cough lately." And, you know, your internet search shows that you're going to possibly die, right? And if I feel that way on Monday, how do you think I'm going to feel from Monday through Friday? I'm going to be extremely stressed, right? But I need to take a step back and I have to ask myself, is it a fact or is it just a thought or opinion that the doctor is going to find something and reveal it to me on Friday that tells me that I'm dying? It's not based on any fact at all. The wonderful thought about knowing that these things are based on thought is that we have access to an infinite number of thoughts. And the thing we have to remember is the thought that we subscribe to is the one that's going to affect us. So if I choose to hold on to that negative thought, that's going to impact me in a negative way. Conversely, if I choose to hold on to a positive thought, then I might get some relief. So in that scenario, rather than saying, "I know they're going to find something, they're going to tell me that I'm dying," I might say, "You know what? I'm working with a clinician who I have confidence in, and even if they did find something, I would be able to work through it with that person." Or you might look back historically and say, "You know, I do this every year. I worry for the entire week unnecessarily, and I'm going to choose not to do that this year." The other thing is, there's certain things that are just outside of our control, and sometimes people just stress over it, stress over it, stress over it. Gas prices are going up. None of us are happy about it, but you know, there's nothing I can do about it. So I have to exercise what we call distress tolerance or find ways to self-soothe. I can't change it. Oftentimes people unnecessarily put themselves through lots of stress because they're trying to change things that are outside of their control. Exercise is a wonderful way to help reduce stress. Why? Because it releases a chemical in your brain called endorphins, which makes you feel good. It can help reduce your adrenaline level, which goes high when you tend to be stressed. It can create a social opportunity if you're exercising with someone else. So there are so many different benefits to doing exercise. I often meet people at the height of their crisis in the hospital, and I have them work out 3 days a week. And they all attest to the same thing. They often are sluggish as they're going into the workout. And when they come out, they say, "That was great. I feel great." And you know what? It also then translates into a better night's sleep. So get out and exercise as much as possible. Paring down your to-do list. Not everything is a priority. Don't make everything a priority. That is extremely stressful. And if you have a lot of things to do, let's say during the course of the day, cluster those things together that are in close proximity, so you're not making multiple trips unnecessarily. Managing your time is really important. Compromising conflicts. You may have a position on something, someone may have an opposing position on something, and your voices start to escalate. You might start encroach on each other's personal space. And in those situations, what we need to do is say, "Oh, that's really stressful. I need to take a step back," right? Remove yourself from the situation. I often tell people, excuse yourself to go to the restroom, because no one's going to tell you you shouldn't go to the restroom. And then while you're in the restroom, you might say to yourself, "You know what? Let me put myself in the other person's shoes," right? Because there have been times that we thought we were 100% right about something, swore that we knew for a fact, or even 200% right about something, and later found out we were wrong. So taking that step back gives me the opportunity to see if there's something I'm overlooking in the other person's position. I might do some deep breathing to calm down while I'm in the restroom. I might send a text message to someone expressing what I'm going through to just vent it. But the idea is to take care of it. And then you might go back out and resume that conversation. And you know what? If that conversation starts to escalate again and it doesn't look like it's going to a good place, sometimes we have to agree to disagree, right? For your mental health, it's worth it. Be realistic. Some people are perfectionists, and being a perfectionist can be extremely stressful. You feel like you have to do everything perfectly. It's not healthy. Every once in a while, we're going to miss the mark on something. Sometimes we do that to other people. We put unrealistic expectations on other people, and then they don't meet our expectations, and it becomes stressful for not only them, but for us. So managing your expectations is really important. Asking yourself, how big will this issue be in the future? If I'm merging onto, there's a part of 287 I have to get onto every morning. And when everyone's doing what they're supposed to do, one person merges in from the right, one person merges in from the left. And, you know, it would be wonderful. It's almost like a dance, right? But does everybody always do that? No. You have that person that's on the bumper of the person in front of them so that you can get in. And in the moment, that can be extremely stressful. And if you've seen road rage really take a bad turn, it can get really ugly. But what I have to do is take a step back and say, how important will this be 3 months from now? You know, the fact that this person didn't let me in. Will it be important next week? Will it be important tomorrow, even later today? And if your answer to those questions is no, 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 and no, you need to let those things go. I kind of think of stressors as rocks, right? Think of rocks that you can fit in your hand, and imagine having a backpack on your back. You take one stressor, that guy that burnt my deli sandwich, and I put that in my backpack. And then someone didn't let me merge in, I put that in my backpack. Someone said something I didn't like, I put that in my backpack. And what happens is over time is you put all these little stressors in your backpack, they become a big stressor, they wear you down. Right? Not only that, they tax you. You're worrying about things that are really not worth worrying about, tax your resources. And so you can't deal with the things that really need your attention. So let go of those little things so that you can alleviate the stress. Regularly take time to reflect on your successes. Gratitude is so helpful. People through studies have found to be healthier. Those people who focus on things that they're grateful for in their life tend to be healthier than those people who focus on the aggravations in their life. We need to do it. Just before going to bed, what happens is your brain doesn't shut off when you go to sleep, which is why if you watch a scary movie and then you go to sleep, your sleep might be interrupted or you have a nightmare. Why? Because your brain continues to process the things you were last exposed to. So one wonderful thing is to do a gratitude journal just before you go to bed, where you write down all the things that transpired during the course of the day that you're grateful for. And you know what? The last things that you are exposed to then are those positive things, which tend to translate into a better night's sleep. Sometimes you have to realize you can't control other people. I don't know if you've ever tried to control someone in your life. It just doesn't work, right? We can control how we react to those people, but trying to control people and mold them, it doesn't work. And it can be very stressful and unnecessary. So don't do that. Change yourself. And in fact, in changing yourself, a lot of times you can change someone else because you no longer react the way they expect you to react, and then they shape their behavior in a positive way. And the last one is actually a big one for managing stress. And this is asking for help. Now, we live in a society where we're told to suck it up, take it like a man, push through it, right? And we're told that, look, if you ask for help, it's actually a sign of weakness, and that is false. I would say that asking for help requires someone to be vulnerable, someone to come to the realization that they can't do it on their own. And that takes a lot of courage to be able to say that. So we need to be okay with asking people for help when we need it. All right. If we feel like we have to, I'm feeling depressed, I don't want to go to Debbie Downer and ask her for help, because misery loves company. So you're going to ask someone who's exercised wisdom in their lives, right? Someone who can be an encourager, someone that can help support you in your time of need. Also, we might go to family members or friends, and they just, particularly when there's things surrounding mental illness, and they just might not be equipped to help us with the help, to give us the help we need. In those cases, seeking a professional can be extremely important. The last thing I want to say about asking for help is, when I ask people, why is it that you don't want to ask for help? They often say because they don't want to be a burden to the other person. But you know, if I poll the room, probably 90% or more of the people, and I say to them, how do you feel when you help someone else? Most times people say they feel good, they feel great. And when people say that, I say, you know what, I want you to encourage you to change your thinking. The next time you need help, rather than thinking to yourself, by me asking for help, I'm going to be a burden to this other person. I want you to say to yourself, by me asking this person for help, I'm creating an opportunity for that person to feel good. There are very few things that make us feel needed in a relationship than saying to someone, I need your help. So I would encourage you to do that. So that's it for stress. I want to now transition to a diagnosis that I see common in working with people, African Americans, and that's depression. All right. And what I'm going to do is actually just give some quick stats on depression and then go through the symptoms that you should look for to determine whether or not you are indeed depressed or experiencing what we call a major depressive disorder. So some common things: it's a common disorder, major depressive disorder. 264 million people globally are experiencing depression. Depression can lead to suicide. And, we're going to talk a little bit about that later. And depression is treatable. That's the thing. Through interventions such as medications, through therapy, you can actually combat depression. So some of the symptoms, and I'm going to read off 9 symptoms for major depressive disorder, and you only need to have 5 of these to qualify as having a major depressive disorder. The first one is feeling sad or irritable most days for several days. The second one is feeling less interested in things that you once enjoyed. We call that in the field, we call that anhedonia, right? That's where you have a lack of interest in doing things you once enjoyed. So if I was a photographer and lately my camera's been collecting dust, that's anhedonia, right? If you usually like going to the gym and working out, used to go 4 or 5 days a week, and now you haven't been in months, that's anhedonia. So paying attention to your disinterest in things that you once enjoyed. The third one is weight, changes in your weight. Whenever I assess people that come into the hospital, I ask them, particularly if they say they're depressed, have you experienced any changes in your weight? And they often will say, yes, it's either one way or the other. They lose a significant amount of weight or they gain weight. Oftentimes, again, eating as a comfort to manage the depression. Some people experience changes in sleep, just like with stress, and you'll see a lot of overlap here. They may experience insomnia or hypersomnia. Another symptom is restlessness. You're just unable to sit still because you're so bothered by whatever it is that has you feeling distressed. Feeling worthless or guilty over things that wouldn't normally make you feel that way is number 7. The 8th one is difficulty concentrating or thinking or making decisions, symptom of depression. And last one is thinking about harming yourself, suicidal ideation. Now, there are different types of suicidal ideation. There's passive, where the person thinks to themselves, life is not worth living. And then there's active, where the person has decided, created a plan as to what they're going to do, and maybe even started collecting the items to do it. We take both of them seriously, but those are the symptoms that you need to qualify for major depressive disorder, and you only need 5 of them. Oftentimes when I share this with groups, they say, wow, I've been experiencing those for a long time, or I have all 9 of those. Well, you know what? You shouldn't neglect it. You should really get an assessment done. But the really thing that shocks people is and I ask people when I share those symptoms, how long do you think someone needs to experience 5 of those 9 symptoms in order to qualify for major depressive disorder? And oftentimes people say, 6 months or a year? And then according to the manual that we use to diagnose people by the APA, you only have to experience it for 2 weeks. And people say, wow, I've been going through this for a long period of time. Well, you need to get the help that you can get. These things, when we're experiencing them, they tend to cause interruptions in our social interactions or conflict in social interactions. They tend to cause issues at work or school or other important areas of function. Now, another question is, what causes depression? Sometimes it's genetics. One other thing that I do, everyone that I assess when they first come into the hospital, is I ask them, do you know of any other family members who have mental illness? And oftentimes you can see a pattern. Oh yeah, my dad, my sibling or grandfather, and you see it. It's usually the same diagnosis. So it is something that is passed genetically. Some people just experience a chemical imbalance in their brain. We don't know what causes it, but just something makes things get out of sync. Interventions can help get you back in sync, but that imbalance can lead to depression. Sometimes it's life circumstances, right? Some things are unforeseen that happen to us, or even things that we anticipate can lead to depression. Trauma. Trauma is something that actually rewires your brain. People who have experienced trauma have nightmares, heightened startle response, and it can also be debilitating, and they can experience it frequently, which could lead to be feeling depressed. Some people have medication side effects. If you read and the pamphlets on medications, I'm not only talking psychotropic medication, any medication, you read them, and some of them, they say, you know what, this could lead to depression. So if you've started a new medication recently and you've noticed that you're feeling sad multiple times a day or all week, you should talk to your doctor about it, because it may be the medication that's contributing to it. Medical conditions or procedures. Sometimes after people have medical procedures, for whatever reason, they tend to experience depression. And then drug and alcohol abuse can lead to depression. What are some of the interventions for it? Therapy, right? Going to a therapist, talking your issues out, helping that person, helping you come up with strategy can be extremely helpful. They might, if you need to get help from a psychiatrist, can provide you with an antidepressant or some sort of medication that can help you manage your symptoms as well. Research shows that therapy along with medication combined is more effective than either of the two done separately. And there's something important about that. Also with therapy, oftentimes people start therapy, let's say because they're feeling depressed, and then over a few weeks, they say, wow, I feel better. So they say, you know what, rather than coming to see you every week, I'll come every other week, or maybe I'll come once a month. But what they don't realize is therapy is a form of an antidepressant. And if you stop it, you could have the same results as if you stopped a medication. And that can lead to severe consequences. The one thing I urge people not to do when I encounter them is do not stop your medication without the guidance of a psychiatrist. Don't start cutting the pills in half, taking them every other day, trying to wean yourself off of them. You can't do that with psychotropic medications. When I ask groups at the hospital, how many of you have stopped medication in the past that you've been on? Oftentimes I have a few people that raise their hand, and I say, well, how did that work out for you? And they say it was horrible. So don't do that. If you try talk therapy, you try medication, and that's still not helping with the depression, we still have other tools. There's something called ECT, electroconvulsive therapy. And, we've seen, if you've seen One Who Flew Over the Cuckoo's Nest, we see this barbaric, electric shock treatment is what it looks like. But I've actually watched someone undergo ECT. I've walked them into the suite. I've seen them get connected. I've seen them receive the treatment, and I walked them into recovery and took them back to the unit. The procedure doesn't take very long, but I can tell you what, there are people who have struggled with depression for long periods of the time, and the only thing that breaks them out of that episode is ECT. So research it. If you're falling in that category where you've tried several different medications and talk therapy and it hasn't worked, that might be an option for you. Lately, what's getting some buzz is ketamine. And ketamine is the person basically gets IV infusions of ketamine a couple times a week. And some people say that that is helpful. It hasn't been used long enough to really have data that supports it too much. So we'll have to wait and see, but people are turning to that these days. So we want to treat it. We talked about stress. We talked about depression. If those things are not addressed, they could potentially lead to something that we often don't talk about in the African-American community, which is suicide. And suicide is real. I meet the people who've attempted suicide and really went for it, and it didn't work. So what do we need to do? We need to know that if we do not treat our depression, it definitely can escalate to suicide. We also know that the reason people commit suicide is because they're often feeling really depressed and in despair. They oftentimes are in pain. When I talk to people and I say to them, I read about your suicide attempt, it's a serious one. Did you really want to die? 9 out of 10 people tell me, no, I didn't want to die. I just wanted the pain to stop. They just couldn't see any other alternative. Some people, the World Health Organization estimates that 1 million people die each year from suicide. Other facts about suicide: people of all genders, ages, and ethnicities can be at risk. Suicidal behavior is complex. There are often multiple things that contribute to it. And as I said earlier, suicide is the 10th leading cause of death in the US when you consider all ages. If you cap that to ages 10 to 34, it's the second leading cause of death. And again, we might be outside of that, but we have to think of our kids and our grandkids that might fall in those age ranges. So what are some risk factors for stress? One is depression. The second one is chronic pain. Sometimes people have gone through back pain procedures, maybe multiple times, and they just don't get the relief. At some point, they just feel like, you know what, I can't deal with this anymore. There's a family history oftentimes of mental disorder or substance abuse, which has a high risk for the person being susceptible to committing suicide. Sometimes there's a family history of suicide. It's another thing I always assess for when I'm in the hospital. Do you know of anyone in your family who's ever attempted or committed suicide? And oftentimes I find out that there has been someone. Family violence also is a risk factor, having firearms in the home. Also, people stockpiling pills in the home. Recently being released from prison or jail has shown to be a risk factor. And all those things need to be taken seriously. Before we release people from the hospital, we have to assess, do they have firearms at home? Have they been saving up pills? And as I'm going to talk about in the safety plan in a few minutes, we make sure all those things are out of the way by family members so that they're not accessible to the person that might be vulnerable. Now, what are the warning signs of suicide? We need to be aware of this for ourselves and in picking this up in our loved ones. The first one is preoccupation with death. If someone all of a sudden is just talking about death all the time and what it might be like, they're writing poems about death, stories about death, you should be concerned. The second thing is no hope for the future. Oftentimes when people get to that place, they have this sense of hopelessness and helplessness. They believe that, you know what, things will never get better. When I talk to someone with major depressive disorder, you know, the first thing I have to do is get them to believe that their situation can change. The one thing that leads to suicide is the thought that the person says to themselves, the way I'm feeling now is the way I will always feel. And when they subscribe to that, they say, I can't do this anymore. And then they want to commit suicide. Self-loathing or self-hatred tends to lead to people committing suicide, feelings of worthlessness, guilt, shame, feeling like you're a burden and feeling like everyone will be better off without you. Getting affairs in order. Oftentimes people, when they're at that place where they say, you know what, I'm going to do it, they'll make out a will, they'll sell their prized possessions, things that you know they normally wouldn't part with. All of a sudden they're giving them away or selling them quickly. Making arrangements with family members is another one. Withdrawing from other people. When people get to that place, they tend to just isolate. When you try to reach out to them, they might not answer the phone. You need to see if someone is unusually being isolative, you need to investigate it further. Self-destructive behavior, that could be increased drug or alcohol use, reckless driving. I met someone last week that was driving over 100 miles an hour, just hoping that something would happen and that would end their life. Unsafe sex. I've met people who will go out and have sex with strangers and do really wild things because their hope is, you know what, who cares? And if something happens to me, that's what I want anyway. And so they go out and engage in those activities. Taking unnecessary risks is another one, or having a death wish, so to speak. Sometimes what we find is when people are depressed, all of a sudden, and it escalates to the point of them wanting to commit suicide, they have this sudden sense of calm. Oftentimes they have that sudden sense of calm because they've made the decision to go ahead and commit suicide. Buying lethal weapons, again, stockpiling medication. If you know people who have bags and bags of medications, encourage them to get rid of them, discard them, because it could be a temptation that could be fatal in nature. Initiating or abusing alcohol or drugs, being overly anxious or agitated might be a sign that the person is getting close to committing suicide. And this showing rage or wanting to get revenge oftentimes are signs or risk factors. So what could you do? Now, if you notice these things in yourself or you notice these things in other people, what you need to do is not delay in getting professional help for that person. Do everything you can to get that person to see someone and be evaluated. You might be able to call a crisis hotline. There's so many of them. There's a suicide hotline. A lot of times in local counties, they have hotlines. And I actually worked for one of those hotlines. And I was the person at the other end of the call when someone was at the bridge contemplating suicide. And I can tell you, more times than not, just talking to the person and getting EMS out there is enough for them to say, you know what, I'm not going to go through with this. So have the person call up. Not only that, those people who are on the other end of those helplines are not only there just to talk, they can provide you with resources in your community that can help you. So use those crisis lines as needed. Encourage the person to go to mental health professional. You know what, you might have to take them there. They might not have the energy. If someone's severely depressed and contemplating suicide, they don't have the energy to drive themselves there. Be proactive and take them there to get treatment. Follow up, make sure the person's taking the medications as prescribed. The thing about antidepressants is on an outpatient basis, it could take 6 to 8 weeks before you feel the full effects. If you start a medication and expect to be cured in 1 or 2 days, you're going to think this is not working, nothing works, and you might move forward. So remind the person that they need to be persistent and patient as they even introduce new medications. Be aware of the side effects. Sometimes medications have side effects. Be aware of them. Talk to your psychiatrist about them earlier rather than later. Be proactive. People who are suicidal, if you say to them, hey, just call me if you need help, they don't call. So stop by, place calls, reach out to them, get them out of the house so that you can take a proactive approach in helping them break out of what they're going through. Encourage positive lifestyle changes like healthy diet, sleep, getting outside for at least 30 minutes each day can be extremely helpful. Exercise, and I talked about the benefits of exercise earlier. Making a safety plan. Making a safety plan is big. Before we discharge someone from the hospital, we have them make a plan. And that plan, it has who they can call in the event that they're feeling triggered again or feeling susceptible to harming themselves. It has a list of the numbers there of their providers, their psychiatrists, the therapists, friends and family members who can be helpful. Might have a list of the crisis hotline numbers so that they have this premeditated plan on what to do if they start feeling like they're slipping back into that suicidal ideation. Remove the potential means. We talked about getting the pills out of there, getting knives, razors, firearms, anything that you think the person might do to harm themselves. And then continue providing long-term support. This isn't a one and done thing where someone expresses to you that they're suicidal. You might take them to the doctor, they get some evaluation, they get medication, and then hands off. You need to continuously be there for long-term support until they actually stabilize. So we talked about stress, we talked about depression, we talked about suicide. These things are actually happening in the African-American community. We don't talk about them much, but there are some reasons why African-Americans don't go and seek treatment in the form of psychotherapy. And some of those things are things I want to highlight now. Number one, African-Americans tend to avoid psychotherapy because of the lack of information about mental illness in itself or the access or benefit of therapy. So mental illness is simply a health condition involving changes in your emotions, thoughts, or behaviors. That's it, that negatively impact your social interactions, your ability to work, your ability to go to school, or other important areas of life, right? These things, as I said earlier, can be biological in nature or they can be circumstantial. And then when people think about treatment, they only think about individual therapy, right? And they're often refer back to scenes they've seen in movies, right? Where there's someone sitting, but you're laying on a couch and someone's sitting behind you, asking you to free associate. And therapy, sometimes therapy is done that way, but not, oftentimes it's not. So knowing that there are different types of therapists is important. And then also, there are other things that you can do. So you can go into walk-in centers now more than ever because so many different areas are trying to fight the stigma of mental illness and help people. There are areas in different counties where you could just walk in and express how you feel. They can give you an evaluation and help you determine what you should do next. So walk-in centers are good. Some people, rather than go into an inpatient hospitalization in the hospital where you sleep there, you might do a partial program where you go for half a day for 2 weeks. often done in group setting, and that could be beneficial. Some people, you know what, they go to an inpatient facility and they still need additional care. There are residential services where you can stay 30 days or more and get additional help. There are group therapy. Sometimes this is also less expensive, where you can be in a room and you can get the benefit of being with other people struggling with what you're struggling with. You know, and the wonderful thing about group therapy, I do lead group therapy sessions, you can take 15 people, randomly select 15 people from the population, put them in a group, and there's certain things that we all can relate to, certain struggles that we all tend to go for. And the grandfather of group therapy, Dr. Yalom, says he has this thing called the theory of universality, which suggests that we all have certain things that we connect with, and group therapy can be a great way of bringing the challenges to the surface and addressing them. Then there's telemedicine, where you don't even have to leave the comfort of your own home, where you can do therapy online via a Zoom type platform. And then there are hotlines. I talked about it. If you're really feeling acute, you're just about to do something, call a hotline. There are local hotlines, and see if you can get help immediately. Now, it's important for African Americans to go to therapy, and I'll tell you why. African Americans deal with mental illnesses or mental health challenges as much as people of other populations, and they benefit from therapy. Additionally, African Americans have stressors that other populations do not have, or do not have to the same degree, such as economic disparities or racism/prejudice. Okay, so other populations, other groups can benefit from it. We can as well. There's something called cultural mistrust, and this is where African Americans have kind of developed this way about interacting with authoritative people of European descent, and they do things that they perceive are essential behaviors to survive and thrive in society. So what often happened, or what's happened in the past, is mistreatment by white healthcare providers in the past have made some African Americans apprehensive about seeking treatment. There's one known in history called the Tuskegee experiment. And in this experiment, which was done between 1932 and 1972, 399 Black men who had syphilis, there was a study done on them. They weren't told what they had. 15 years into the study, they came up with a solution, a remedy, penicillin. They did not offer that to these people, to the African-American men. And they really just wanted to, for the sake of research, to see how African-Americans would fare with syphilis untreated. And a lot of people died from that. We don't know the long-term implications and how it impacted generations from that. But we do know that it was such an atrocity that decades later, President Clinton apologized for it. So that's one reason that people are a little reluctant about going to seek care, because we know what's happened in history. Some other things, African Americans are 3 to 4 times more likely to be misdiagnosed with psychiatric disorders and mental illness. So people stay away for that reason. Some African Americans experience a history of being prescribed medications without a proper evaluation. I moved into my area, now it's been almost 15 years, but I had a doctor. I have high blood pressure. And I said, oh man, I need to find a new provider in my area. So what did I do? I went to some list that said top 100 doctors. I found a cardiologist in my area. I said, this is fantastic. The person was right in town. I went in, I expressed to the person, I have a family history of hypertension. I've had hypertension for years and I was managing it. The person said, the doctor said, I've never heard of the blood pressure medication you're on, showed little or no interest in me at all, and never even took my blood pressure. Now, think about it. I'm telling you I have high blood pressure. I'm coming to you as a cardiologist and you never even check my blood pressure? Needless to say, I didn't go back. But if you have experiences like that, you sometimes say to yourself, you know what, am I going to get the care that I need? And sometimes people forego because they have those experiences in other areas. They say, you know what, what's the point of seeking therapy? So after some African Americans feel stereotyped, particularly as African American men, they feel like, you know, we're so stereotyped in the community and in society in general that, you know, if I go to somebody for help, they're going to assume certain things about me and not give me the care I need. And all those things contribute to cultural mistrust. But in addition to cultural mistrust, there are other reasons African Americans don't seek treatment. One is stigma, right? Holding on to strong beliefs that go against seeking therapy. I've often heard people say, man, you don't people who have to be crazy in order to seek therapy or go to a therapist? I'm not crazy, quote unquote, crazy. And they forego it because they have this stigma of what mental illness is. You know what? They feel like, you know what? They're the only person going through it. When that I can tell you is not true. In fact, I often tell people, if there was a way to make people glow, that you pass in your normal going and comings during the course of the day with a mental illness, you would be surprised on who's glowing around you. It could be your dentist. It could be the guy that just pumped your gas. It could be your next door neighbor. It could be your professor. It could be anyone, because so many people have mental illness and we just don't know about it. So you're not alone, but that's sometimes just that thought that we're alone, we're the only ones going through it, prevents people from going and getting help. And some people have this mindset, I find it, where they're just like, look, I'm not putting my stuff out there. We have family things that we're not trying to dig up. We're trying to keep those things quiet. And therefore, I'm not going and I'm not talking to anybody about it. But what you have to realize is that, you know what? Realizing you can't fix yourself on your own and being vulnerable are the very things that you need to get the help that you actually will benefit from. Some people are unaware that they have a diagnosis. I read to you guys the symptoms of depression, right? You only need 5 out of those 9 and only for a 2-week period. Some people have been struggling for weeks or months or even years with those symptoms. So they're walking around with a diagnosis and they don't even realize it. And if you don't realize you have it, you won't seek treatment for it, right? Because if you don't identify a problem, you don't think you have a problem, what would you seek treatment for? Some people doubt that treatment will be effective, right? The thought in my, talking to some people, they say, that wasn't created for us, man, that therapy thing, it wasn't created for us and therefore it won't benefit us. And that is far from the truth. I've seen several people benefit from psychotherapy. And they might say to themselves, you know what, I've tried the therapy thing in the past. I went and saw a therapist back in 1988 and that didn't work out for me. So I'm not doing that again. And it's important to know that there are different types of therapists. So if you went to a therapist and your therapist said, you know what, just tell me how you feel. And that seems to be the only thing they ask you during the course of the session. That might be more of a person-centered therapist. And the reason that person takes that kind of approach is because they believe you have all the answers inside of you and that the therapist just needs to provide empathy and compassion in a warm environment and build that rapport with you, and you will somehow figure out the solutions to your problems. Some people benefit from that type of therapy. But on the other end of the spectrum, there's something called solution-focused therapy, where you might go into your therapist, my therapist might say to you, what's been happening this week? You work with the therapist on that, come up with what you're going to do next and talk through it. And then you're on to the next session the following week. So there are different types of therapy. And I gave you both extremes. There are different types in between. So just because therapy didn't work once doesn't mean it won't work for you again. Perhaps it was the wrong type of therapy that you're receiving, or maybe you just didn't have the connection with your therapist. Some people say, you know what, there are a lack of African-American doctors who can do therapy and therefore I can't find one. It is important to know that there are master's level clinicians that can help you, like social workers and mental health counselors. They are trained and skilled to help you work through mental illness. So if you open up your search to these master's level people, you will find that there are actually more options available to you. People say, you know what, sometimes they're unsure what to expect from treatment. Oftentimes when I get people who call me, they don't know. They didn't have it modeled in the African-American community. We don't have generations of family members who went through therapy, right? Some of them went through family therapy together, couples therapy. They watched mom and grandma and grandpa go through therapy. In the African-American community, oftentimes we don't see that. So this is foreign to them. So I have to oftentimes initially in my initial consultation, explain how therapy works. How long is a therapy session? How often should someone go? What are you expecting to happen? All those questions, because they just don't have the exposure to it, like some other populations. Some people think that, you know what, if I go to a psych hospital for evaluation, even though I'm feeling really bad right now, they think they're going to lock me up in there forever. And I can tell you with managed healthcare, that is far from the truth, because the moment you step foot into the hospital, the healthcare, your managed healthcare insurance provider wants a plan put in place on when we're going to get you out, right? So you won't be in there forever. And I always say to patients that are in inpatient hospitalization, I don't want to keep you here a day longer than you need to be, but I also don't want you to be out of here prematurely and have to come back. We don't know, it's different. The stay is different for everyone, but we just want to see you get better. Some people think that, mental health seems less important than other responsibilities, right? On one hand, you say to yourself, I'm thinking about going to this therapist. It's going to cost me a lot of money, but you know what? My job is offering overtime. Overtime oftentimes wins out, and they say, I'm not going to go do that therapy. And therapy can be costly, let's face it. So some people say, there's the expense of therapy. And if you have children, then you have to pay for childcare on top of therapy. And they say it's too much. Some people make mistake conversation with friends as therapy. Yes, it can be helpful in some situations, but I can tell you what, if you're experiencing major depressive disorder, if you're contemplating suicide, sometimes it's not enough. And oftentimes, also in the African-American community, we oftentimes find that people turn to their pastor, right, or religious leader for guidance and direction. And that's fantastic. But you know what? Sometimes those religious leaders realize they're dealing with something they've never seen before, they're not equipped to deal with. In those cases, they should then pass them on to a clinician who is experienced and can help them. All right. So just really quick, I'm going to recap some things you're going to look for in general. I would encourage you to move towards getting therapy rather than staying stuck, but changes in the appetite, low energy. We talked about sleep issues, crying excessively. If you're crying spontaneously, something is going on inside. Audio hallucinations, visual hallucinations, paranoia, extreme paranoia to the point where you don't even want to leave the house. You need to get help. Self-injurious behavior, talked about. Challenges at home, work, social interactions that seem to get the best of you. Therapy can help. People neglect their, what we call ADLs, activities of daily living. So they stop showering, stop taking their household chores. They stop, their rooms are a mess. They're not eating or cooking for themselves anymore. Often signs that something is going on that needs to be addressed. We talked about isolation, drugs and alcohol. Poor concentration, anhedonia, excessive fearfulness, obsessive compulsive behaviors. If you find that you keep running back into the house to do certain things or rituals, perform rituals, and it's gone to the point where it's interfering with you getting out and making your appointments, you need to get it addressed. And then nightmares, particularly with people who are experienced trauma. For my closing thoughts, I just want to say, I would encourage you all, particularly in the African-American community, to make your mental health a priority. It will benefit you, it'll benefit your family, it'll benefit your physical well-being. Take a proactive approach to self-care. Oftentimes when I talk to people, they're like, what the heck is self-care? That is where you are doing things intentionally for yourself. Some people find going to church or praying extremely helpful. Some people, deep breathing exercises or meditation. And I can tell you, as a clinician, when I first started in the hospital, they were like, Terrence, we want you to do meditation or deep breathing exercise. And I said, what is the point of this? But you know what I've done? I have actually some cards that measure a person's stress level. And I would often have people in a groups therapy session put their finger on that and measure their stress level. And oftentimes they would be tense or some tension. And then I would administer a deep breathing exercise or meditation. And you know what happened? I would test them again and they would go down to calm. And that oftentimes is an aha moment because they realize this isn't just some silly thing that I'm doing. It actually works. So doing some of those things are important. And now on your phones, you can download apps that give you access to meditations, deep breathing. Some that I recommend, Calm is one, Insight Timer is another one, and Headspace, which actually keeps track of how many consecutive days you've meditated. Socializing, we talked about the importance of it earlier. Whether you're introvert or extrovert, you need to feel connected. So get out, make new connections if you've lost connections. This pandemic has taken a toll on our ability to socialize, and we need to come out from that. Volunteering is something I prescribe to everyone I encounter, and I'll tell you why. It is very difficult to be hard on yourself when you're pouring into other people. There are so many different ways to volunteer. You can go to volunteer.org to find some. You can work in a soup kitchen, whatever works, at a library, whatever works for you. But when you help other people, as I talked about earlier, it makes you feel good. Not only does the other person benefit, you do too. So get out and do that. NAMI.org, National Alliance for Mental Illness. You can go to that website. They have services for people struggling with mental illness, but also for the loved ones of someone struggling with a mental illness. So if you feel like you have parents that don't understand, or maybe siblings that don't understand, or maybe kids that don't understand your mental illness, you can have them attend what they call a family-to-family program, and it's offered free through NAMI, and they learn about mental illness. They learn how best to support you, and it's absolutely free. So I would encourage you to look into that. There's group therapy supports, which is more economical. I said that earlier. Self-help books. Now you can get these things on your phone. You can download audio books and listen to them on your commute to work. That can be impactful and helpful. Sometimes your providers, they may not accept insurance. You can ask them if they use a sliding scale, which means they're willing to adjust their rate for you. Some won't, some will, but if you don't ask, you'll never know. Sometimes churches and local organizations will subsidize part of the cost. So ask your local church, maybe if you're a member, to see if they'll help pay for some of your therapy. Attend community mental health workshops. There was one for free that I attended this weekend. It was on borderline personality disorder. It was all day long, absolutely free. They're out there. If you look for them, you will indeed find them. And if you're struggling, or if you know of someone, a loved one who's struggling, have them get help sooner rather than later. Thinking back to that snowball analogy, whether you're struggling with stress, depression, or suicidal thoughts, you don't want those thoughts to pick up momentum. So get out and get help sooner rather than later. For depression, I always say, think of it as when you first start experiencing depression, it starts the episode. The longer the episode goes on, the more resistant it becomes, because it does something we call crystallizes. So you want to address it early. Or sometimes I interact with couples, and the couples, they just came from signing the divorce papers at the attorney's office, and now they want to come for counseling. Start it sooner rather than later. The longer you let it go on, the more chances that you'll say and do things to your spouse that you later regret. So get help early. The sooner you get help, the sooner you'll get the relief. And that's all I'd like to say. Thank you so much.
Well, Terrence, I will say thank you. You have given us a wealth of information for us to digest. It really was excellent. We do have a few questions that we'd like to ask before we wrap it up. First question is, and I think you just touched on this. In fact, I know you just touched on this a little while ago, but how has the pandemic impacted the mental health of members of the African-American community?
It's a good question. It's impacted everyone, but particularly in the African-American community, I've heard of, people, not everyone had the luxury of working from home during this pandemic, right? Remotely. So people, particularly who were working hourly jobs and they needed to be there, but they were shut down because of the pandemic. When that first happened, that was extremely stressful, right? Then we had some reprieve, right? We found that the government was going to give us, not allow people to get evicted from their property or foreclosed on their house. There were some stimulus checks that went out, and that provided some relief. But initially, imagine how that felt, knowing that you can't go to work to make any money to support your family. Extremely stressful. And now that we're coming out of it, guess what? The utility companies are saying, oh yeah, now we want to start collecting the money again. And if you don't, we're going to report you to the collections agencies. I just heard that recently that landlords now have the ability to start evicting people. And, landlords, particularly in New York City, we're hearing that the rents are increasing significantly. So there's an incentive to want to get people out. And so that can all be stressful. Again, we had that little break, but now it's a very stressful time because people have to figure out how to make ends meet again. And that's challenging. For adolescents, I can tell you, when the pandemic hit and I worked on the COVID unit, so March 2020, I was on the COVID unit when we didn't know what this thing was. And there was a huge influx initially of homeless population. What was happening is a lot of them were getting COVID. The shelters were kicking them out. They were on the streets without medications. Their mental health got the best of them, and then they had to be hospitalized. It shifted along the way. Somehow we saw that population decrease a little bit. And then about a year ago, we started to see a rise in adolescents. And the adolescents have had a really tough time with this pandemic. at this stage of growth in this, in their adolescent years, it is so important for them to make social connections. And this pandemic has hindered that tremendously. So we're finding that a lot of them are finding it difficult to cope and needing services. We've had to double our capacity at the hospital because we've had such an increase in the last year. So that has been challenging. In addition to that, there were other things that we just, socialization, it just went to the wayside. You were in the house, you couldn't go out. And people now have forgotten how to just converse with other people. We got such into the habit of just asking, did you get the vaccine? Did you get the vaccine? Did you have COVID? That's all we talked about for about a year and a half. And now we want to go back to some normalcy, and people have forgotten how to just have a normal conversation. So in therapy, I actually share tools on how you can just get back to having normal interactions with people. We also found, we had households where you had kids and two people and both members of the family worked, and then the pandemic hit and they were put in this incubator together. Everyone was in the house all day, every day, and that caused a lot of challenges. A lot of stresses on relationships happened. Some people were stuck in the house with their abusers, which created issues. The kids, you have 4 or 5 people trying to get online at the same time, trying to vie for space. This person's taking a corner, that person's taking a corner, and it created a lot of issues. So although the pandemic, it's still here, right? We're seeing numbers go up again. And it's not quite impacting us the way it did now that we have vaccines and we know more about it, but still the after effects of it continue to impact people in the African-American community, and support can help them get through it.
All right, thank you very much. The next question that we have is, if a person seeks therapy, will they have to tell their potential or current employer their diagnosis? And will their employer have access to their therapy notes?
Okay, so the short answer to that question is no. The ADA, Americans with Disability Association, said that, we have the right to privacy, and you do not have to disclose your diagnosis to your employer. They certainly don't have access to your notes with your therapist. And they say that if you decide that you need accommodations at your employer, then you might want to disclose. And even in disclosing, there are different pros and cons as to when to disclose, right? So some people say, maybe I'll disclose on my initial application. Well, there's some implications of doing that. Some people say, well, maybe I'll disclose when I get involved in the interview process. Well, there's some pros and cons to doing it then. Others might think, well, maybe I'll just start on the job, I won't say anything, and then I'll let them know. There are pros and cons of doing that. That's a whole other conversation. But the thing that I want to take away is you do not have to tell people that you have a diagnosis when you apply for a job. Some applications, they might say, do you have it? And oftentimes they'll give you the option of saying, I don't, I wish not to say, but you don't have to do it. You have the right to your privacy. And the only way your therapist can really release those notes is if they're subpoenaed from a court, or if you give a release to your therapist to release the information, confidential information discussed in therapy.
Okay, thank you, Terrence. The next question is, does asking someone if they are suicidal, does that make them suicidal?
The answer to that is also no. And oftentimes people assume that. People think that if I see people going through some of the things that I talked about earlier, getting rid of their prized possessions, making plans, saying goodbye to people like as if they're leaving forever, you need to ask that question. The people that I've met, and again, I've met people who have walked into traffic, jumped off bridges, jumped in front of trains, who've survived. And you know what they say, Terrence? You know what? It was like no one cared. No one even asked. I was exhibiting these behaviors. No one said anything. Everybody just looked the other way. So no, asking someone if they're suicidal is not going to make them suicidal. In fact, asking someone if they're suicidal might be the very thing that can save their life.
Okay, that's definitely good to know. And the last question that we have is, what can I do if I want an African-American therapist, but I can't find one in my immediate area? That's it. Go ahead.
Okay, that's another good question. The good thing about the pandemic, right? It created this thing called telehealth that is now makes it so easy to get therapy. So oftentimes when people search on websites like Psychology Today, for instance, they might type in their zip code and limit their search in the past to a 10-mile area, and then they realize, I don't see many African American clinicians in that area that can help me. But now with the, able to do telemedicine, what you find is you can broaden your search. So you could be in, let's say, in Westchester and seek treatment from someone who's in Albany, a therapist via some sort of telemedicine platform. So it's important to know that now you have more accessibility. As I said earlier, you don't have to just look for doctors. You can look for master's level clinicians. So that gives you more people, a larger pool to select from. And then the last thing I'll have to say, even if you broaden your search to a 200-mile radius, and for some reason you don't feel like you can find an African-American who can help you, I would say still do not forego getting treatment. Find a therapist who seems like they can address the symptoms that you have. Oftentimes they tell you what their specialties are. And even if they don't look like you, get the treatment. There are people that I help, and I help effectively and efficiently, that are not African Americans, who have different religious beliefs than I do. So the one thing about being a trained professional is you're trained to be culturally competent. You're trained to learn from your client. So I would say, even if you can't find someone after broadening your search, and I don't know why you wouldn't be able to if you broaden your search that far using telemedicine, but don't forego treatment. Find someone that doesn't look like you and at least start treatment there. If later on you find someone else, you can always transition.
This has been great, Terrence. We really appreciate you taking the time to share your knowledge and your expertise with us. And as I said earlier, this is a wealth of knowledge that you are giving us, so much so that I think that we need to have a part 2 and maybe a part 3 and perhaps a part 4, because there are a lot of different areas of mental health awareness that you haven't even had a chance to touch on today. So we look forward to having you come back in the future. But once again, we thank you very much, Mr. Terrence Nichols. And Terrence, once again, can you just give the information of where folks can reach you if they would like to be in touch with you? What is the best way to do that?
Absolutely. So you can visit my website, which is westchestermentalhealth.com. And on that website, you'll find a way to interact with me via email. Also, my phone number is there, but I'll also reveal my phone number now. It is 973-886-8209. The number again is 973-886-8209. And yeah, send me an email. Even if it's a question, I'm happy to answer them. One thing I try to do, sometimes I hear people say they call therapists and they don't hear back. I try to get back in 24 hours to people, even if it's someone that I can't help. It's just to have that discussion, and maybe I can point you in the direction of someone who can.
All right, that's great. Once again, thank you very much, Terrence. And we look forward to hearing from you again. And we look forward to having another broadcast, or 2 or 3 or 4.
I would love to come back. Thank you so much for having me.
Thank you.
On behalf of African American men of Westchester, I want to thank you and our viewing public. As a FYI for our various publics, because of the volume of information that Mr. Nichols brings, we hope that we will see him again in a future session